Speaker, Kiwis expect a decent public health system, and Westies are no different.
That's right.
In West Auckland, we love our hospital on Lincoln Road.
We do.
The staff are great, they do their best, but it makes Westies so mad that our hospital is so badly underfunded and understaffed. Patients are waiting too long to get the care that they deserve because the nurses are too busy to get to them. And why is that? Because this national-led coalition government is underfunding and understaffing the public health system. The numbers don't lie. Between January 2024 and June 2025, documents released under the Official Information Act show that 71% of all shifts at Waitakere Hospital were understaffed. 3 of the wards in the hospital, 2 of the general medical wards and the maternity suite were understaffed for 1/3 of all shifts in that 18-month period.
Shocking.
The Huia ward, a 20-bed acute unit that caters for a range of acute medical and cardiac patients, was understaffed for nearly half of all the shifts in that period. And across the board, these numbers show that Waitakere Hospital has been running short by 20 nurses. 20 nurses down on the number needed to deliver the official and agreed safe staffing levels. Mr. Speaker, it's a simple equation. Underfunding leads to understaffing, and that leads to people not getting the care that they deserve when they need it. Scott of Te Aratu Peninsula told me that he turned up at Waitakere Hospital at 4 a.m. on the advice of his doctor after he started bleeding profusely a week after surgery on his nose. He was admitted, but then spent 6 hours. He spent 6 hours on a bed on wheels in the middle of the emergency room with people working all around him. They told him there was nowhere else to put him. And in all that time, he never got to see a doctor. Judy, another of my constituents, gave birth to a baby girl back in May. Due to some complications, Judy was booked in for a C-section at Waitakere Hospital. When the big day came along, it was all go, the contractions were happening, and suddenly the clinical staff told Judy that she had to go to North Shore Hospital because there was a lack of experienced staff at Waitakere. Judy also felt let down after the baby was born. She had to go all the way to Warkworth because Waitakere Hospital doesn't yet have birthing units. West Auckland new mums have to go to Helensville and Warkworth to use their postnatal care birthing centres. In Judy's words, it's woeful. Craig of Swanson told me he went to Waitakere Hospital a couple of months ago with a broken collarbone. He waited 2 hours before he was admitted, had an X-ray, and was then told they couldn't deal with it and he'd have to go to North Shore Hospital. His wife drove him there and he had to wait 3 hours before being sent home without seeing a doctor and being told the hospital was overloaded. Mr. Speaker, these stories are not uncommon, but they are not good enough. Our healthcare workers are exhausted. Is it any wonder they're leaving in droves for Australia, where they have minimum nurse-to-patient ratios and much better terms and conditions? These people became healthcare workers because they wanted to help people and give people the care that they need, not risk their suffering because of a lack of staff. The people of West Auckland demand a decent public health system that's there for them when they need it. This government has made bad decisions and has the wrong priorities. It's given tax cuts to landlords and property speculators and tobacco companies while it underfunds and understaffs our hospitals.
That's right.
And the people that I represent in West Auckland demand better.
Nice. The Honourable Julianne Genter.
Tēnā koe, Mr. Speaker. There will be no surprise that I rise to speak about